Welcome to Diabetic Retinopathy, Preserving Your Eyesight at Diabetes Eye Health. My name is Dr. Richard Beezer, and I'm a senior physician and chair of the Continuing Medical Education Committee at Joslin Diabetes Center in Boston. I'm pleased to serve as moderator for this program. One questioner wants to know about what they can do when they're recovering from some of these treatments, a vitreous hemorrhage, some of these other treatments. Is physical activity harmful, or anything specific that they should watch out for?
Yeah, that's a good question. If there are active blood vessels in the eyes or macular edema, we usually recommend, especially with active blood vessels, no high impact activity such as jogging, but certainly walking on a treadmill, doing an elliptical is fine. But we try to tend to avoid high impact where you're jumping a lot, or Valsalva where you're straining or doing heavy lifting. So we usually tell people not to lift more than 10 or 15 pounds. And there are really no studies to back that up. It's a very hard thing to study, but just intuitively it's thought that if you have fragile blood vessels growing in your eyes, that can increase the risk of bleeding.
Is that ongoing? I mean, or for a certain amount of time after the treatment?
I think it depends on how the retinopathy looks, because years later when the retinopathy is all quieted down, then people often go back to normal activity. It's a good question.
Are vitamin supplements of any help? People often ask that.
I don't know. I know there are so many different studies. I mean, there are some that have been shown to prevent certain types of macular degeneration. For diabetes, I'm not quite sure. I think there are mixed results.
And macular degeneration and diabetic retinopathy, any relationship?
Are different, but the macula is involved because that's just anatomically the portion of the retina that's involved, so it's the part of the retina responsible for detailed vision, but it's a different process.
Baby aspirin and bleeding in the eye.
That's a good question, and that was actually looked at in one of the major early treatment diabetic retinopathy study, and aspirin was shown to have no benefit and not be dangerous. It didn't increase the risk of bleeding. So if you are told to take aspirin, I wouldn't not take it, and I wouldn't take it because you think it'll help with your eyes. It really has no effect, as we know, on retinopathy.
We've got a lot of very good questions. One questioner wants to know, they've got some carotid occlusive disease, blocked carotid artery, which is common in people, particularly with type 2 diabetes. Is there any relationship between that and diabetic retinopathy?
There can be. There can be. You can have little pieces of cholesterol that can break off and cause little clots in the retina, and also it can limit the blood flow to the retina. So if they have known carotid obstruction, it's probably a good idea to have more frequent eye exams.
And to that point, cholesterol treatment, is it helpful for retinopathy?
That's on and off also. I mean, not completely clear.
Okay. Evelyn and Peg, cholesterol treatment, have you folks dealt with that? What advice would you give?
Well, for me, I don't have high cholesterol. I have actually low cholesterol. So I have enough to deal with. I don't want to add cholesterol, but you know, it's a concern, and I keep getting my cholesterol checked every time I go in. So, but I don't know about you.
Well, actually, I was very long into my diabetes with very good cholesterol control, but somewhere along the line there was a theory that we should do preventive cholesterol treatment. And so I was put on a cholesterol medicine. And after I was put on it, there is still a reluctance to take me off of it. So I'm still taking it at the most minimal dose you can take, but I am still on it. And my cholesterol is still fantastic. The bad cholesterol is low, and the good cholesterol is in the good range, and I'm happy. Thank you.
That may be a little different for people with type 2 diabetes. So I think my advice would be for people, particularly with type 2 diabetes, to talk to their providers. There are new guidelines out there for cholesterol treatment, and I think it's worth a question if you're not sure what to do.
Again, communication. You
got it.
And you know, I do have a fear about my diabetes because I always get everything checked, my kidneys, everything checked, everything's looking hunky-dory, but I have retinopathy, right? So I wonder what else is going on in my body, and that worries me. And I get the regular checks, you know, like I said, the kidney function tests and everything else, and so far so good. Is there any other test I should have for anything else?
The relationship between kidneys and eyes has been recognized for a lot of years.
Yeah.
So I think the important thing is to monitor your kidneys with your primary doctor or diabetes specialist or whoever is doing it. Make sure that's being done and ask about microalbumin or albuminuria, amount of protein in the urine, and is that being appropriately treated?
Yeah, yeah. I do have that very close. I follow that very closely, especially since this popped up.
Yeah.
So.
Evelyn, earlier you mentioned pregnancy and that issue with respect to retinopathy. Perhaps Deb, can you tell us anything about the relationship between pregnancy and retinopathy? And Evelyn, perhaps you can talk about your experiences. Deb,
years ago, people were told not to become pregnant at all with diabetes, but the key is really just, again, close follow-up. I mean, I've had many patients who are pregnant. We like to see pregnant patients at least every trimester because some of the hormonal changes, growth hormone, can cause progression of retinopathy. And then we usually follow them a little more closely for 6 months postpartum. But patients have done very well. I've had some patients need laser during pregnancy, and it's a non-invasive, done in the office, just topical anesthesia with no problems. Ideally, we like to see people in the planning phases of pregnancy because sometimes if they have active retinopathy, we can treat it beforehand. And then there are also issues of delivery, whether they should have C-sections. And again, we really work with the obstetricians and determine based on the level of retinopathy at that time.
So it's good vigilance.
Yeah.
Yeah.
The thing I can say about pregnancy is that if I did not have diabetes, type 1 diabetes, I would have been pregnant a lot more of the time because I did absolutely love the state of pregnancy. But I am very grateful that I have 2 healthy kids, the first one of which was born on an insulin pump study. So I'm very proud of that fact.
We've come a long way, Evelyn.
Absolutely.
Thank you to Genentech for their support of this educational program. I would like to remind you that additional videos are available at diabeteseyehealth.com. Thank you for joining us.